Hey everybody, my name is Janelle. I'm on the team here at Avenues. Today I'm joined with Emily Wilkins. She's our clinical director at Avenues Recovery Center at Dublin. How are you today, Emily?
I'm doing wonderful. How are you?
I'm doing great. Just wanted to get your thoughts on, this time of year, there's a lot of people who are struggling with, staying positive, keeping a good handle on their self-care and that kind of stuff. Have you noticed that, and what kind of signs do you see with that?
So I think in the colder months, struggles can become amplified. It's dark out, it's cold, and there absolutely is a pattern for individuals who have mental health struggles for them to be more enhanced or amplified during the colder months.
Is there a name for it?
So it really depends on the situation. Many people call it seasonal affective disorder. Some people call it, I think before individuals were more aware of seasonal affective disorder, people would just call it the winter blues, or I'm just down all the time. And then if you have an actual mental health diagnosis, it can be called just seasonal patterns. But I think most people now recognize the term seasonal affective disorder.
How would that affect somebody? Like, what are some common signs or symptoms that you could, self-assess almost?
So it would be a marked difference.
Okay.
So if typically you're someone who is very sociable, you like going out with your friends, and all of a sudden you're not returning their phone calls, you're staying home, you're isolating. Eating patterns change. You tend to eat more carb heavy items can be signs. You lose interest in activities that you typically enjoy. Every Friday night you would go out to play cards with your friends or go to a movie with your friends, and now you're canceling or not answering the phone when they call. You feel tired all the time, like you just need to stay in bed and sleep. Maybe you're calling out of work. You just don't want to deal with it that day. And it's not an incident that just happens one day. It's an ongoing issue.
More of a systemic thing. Gotcha.
Yeah.
So say that, if I'm noticing these signs in myself, or I'm noticing them in somebody else, like, what are some practical ways that, you could stay positive, upbeat, get back into that, pull yourself kind of out of that slump mentally?
Mm-hmm. I think one of the things that can trip people up is the notion of, I gotta pull myself out of this. It's really hard to pull yourself out of some of those depressed feelings, especially if you also have some substance use struggles, or you already have a mental health diagnosis, some things that you're struggling with. So having things in place proactively is the best plan, right? You've already told people that you love, hey, I struggle with this. If you notice me pulling away, reach out to me, ask how I'm doing. Or there are some activities that really help increase endorphins during colder months. Lifting weights is a great way to build endorphins. Going for a run, getting a membership at the Y and going swimming in a warm pool. Those are some simple things people could do for low level, the blues. But if it's beyond that, if someone they can't get out of bed. I can't get out of bed. It's time to talk to your doctor. Your primary care doctor is a great place to start. If you don't have a primary care doctor, you talk to your family, you get a primary care doctor, you go to local support, you go talk to your minister, you go talk to your sponsor, you go talk to your priest, anyone that can help start connecting you with other resources. Because for some people, they need more than just those activity interventions, right? They might need to go see a doctor about it.
Do you notice a connection between people with substance use disorder and seasonal affective disorder, like, pretty commonly, or does it really affect just anybody?
It definitely can affect anybody. I think because of the high rates of mental health issues for individuals that struggle with substances, I think that tends to be more of the correlation. An individual with bipolar is at a higher risk of experiencing depressed feelings in the winter months. If you have depression or dysthymia, there's a higher chance in the colder months of that being a struggle, and then it affects your substance use disorder as well. If you have a significant trauma history. But then also if you struggle with substances and you're already pretty disconnected from your community, then you add on it being cold and dark, and that definitely can amplify some of those feelings.
Gotcha. So it seems like kind of the way to combat a lot of this is just to really lean on people, lean on your network, your support, your community, whether that's your family,
Yes.
whether that's a sober network, and that kind of, helped a lot. I liked how you said earlier, you can't pull yourself out. It's really an everybody thing, and that's why it's so important to have so many people in your network that you're connected with that love and care about you.
Yes.
Perfect.
Yeah.
Do you have any other thoughts on the topic you want to add?
Now, of course, up here in New England, it can be more of a struggle than other places, and it happens to a lot of people. And a lot of people just shrug it off as, well, this is what happens in the winter. Everybody feels this way, and you don't have to. You don't have to struggle through those, fall and winter months. It does not have to be a miserable time. There are simple interventions that can really help you feel better. You just have to reach out.
Perfect. Well, thank you so much for your time, Emily. I really appreciate it. This was a great conversation. And as always, check back with our channel. We upload these every month, so you can check back in for the topics that we cover. Thank you all for watching. We'll see you next time.